Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Living healthy. Introduction. Many diseases that cause disability and death can be prevented or delayed. Practicing healthy living habits and having regular medical screenings can help you avoid these illnesses. This can help you live a long and healthy life. This program explains the steps that you can take to live a healthier and longer life. It also discusses the 10 most common causes of death in the United States. Number 10 cause of death: suicide. Suicide is the act of ending your own life. It is a major public health concern. Each year, approximately 1 million people die by suicide worldwide. People may consider suicide when they are hopeless. They may not be able to see any other solutions to their problems. Suicide is often related to serious depression, a major stressful event, alcohol or substance abuse. When a person does not have hope for the future, they may wrongly assume that suicide is a solution. The person may not be able to imagine a time in the future when the crisis will be over. Suicide may seem like the only way out. If someone talks about suicide, you should take it seriously. Urge the person to get help from his or her healthcare provider or from a therapist. Some areas also have suicide prevention hotlines. People can call these hotlines to get immediate counseling when they have suicidal thoughts. If you are having suicidal thoughts, get help from a professional. Therapy and medicines can help most people overcome suicidal thoughts and improve their lives. Number 9 cause of death: kidney diseases. Kidney diseases such as nephritis, nephrotic syndrome, and nephrosis affect the function of the kidneys. This causes the kidneys to lose a lot of protein in the urine, which in turn can cause severe swelling. Kidney diseases can be caused by other diseases, such as diabetes or lupus. Sometimes kidney diseases can happen for no known reason. Controlling diseases that affect the whole body, such as diabetes and hypertension, can help prevent or slow down the progression of some kidney diseases. There are also some medications and dietary changes that can help improve kidney function. Number 8 cause of death: influenza and pneumonia. Influenza, or the flu, is a viral infection that can cause pneumonia. Pneumonia is a lung infection that can lead to death in older patients, especially smokers. Healthy lungs are able to fight infections and recover faster than lungs damaged by smoking. Stopping smoking is essential to improve the chances of survival from lung infections. The lungs and hearts of younger people are usually healthier than those of older people. This explains why older patients are less likely to recover from lung infections than younger patients. Vaccines to prevent influenza and other forms of pneumonia are available. They help give some protection against potentially deadly lung infections. Number 7 cause of death: diabetes. Diabetes is a disease that makes it difficult for the body to use the sugars we eat. Diabetes can be controlled, but it cannot be cured. The causes of diabetes are not known, but there is evidence that it usually runs in families. Diabetes is diagnosed when a healthcare provider checks the level of sugar in your blood or urine. If you feel tired or lightheaded, or if you urinate frequently, you can have your blood glucose checked. People with diabetes have a higher than normal level of glucose in their blood. Number 6 cause of death: Alzheimer's disease. Alzheimer's disease is characterized by progressive dementia. It starts with forgetfulness, but over a period of years it leads to the inability to perform daily activities. It can often lead to death. There is a genetic component in some cases of Alzheimer's disease. Therefore, it is more common in family members of Alzheimer's patients. Currently, there is no clinically proven ways of preventing Alzheimer's disease. Some medications are available that help slow down the progression of the disease, but there are no cures yet. Number 5 cause of death: stroke. A stroke, also known as a brain attack, happens when the flow of blood to the brain stops or decreases. When a part of the brain is deprived of blood, that part dies. Depending on the size and location of the stroke, the result may be minimal paralysis or, in severe cases, death. There are 2 general causes of stroke. First, the arteries narrow, allowing less blood flow. Second, blood clots or debris can float into brain arteries and block them. These blood clots or debris can originate from blood vessels in the neck or the heart. The blood vessels narrow when cholesterol and plaque are deposited in their walls. Smoking, high blood pressure, and inactivity make the narrowing of the arteries worse. A high intake of salt and a stressful lifestyle can cause chronic increase of high blood pressure or hypertension and may lead to narrowing of the arteries. Heart disease can cause weakening of the heart and can create an abnormal heart rate. This can result in blood clots inside the heart. These clots can then travel to the brain and cause strokes. You can help prevent strokes by stopping smoking, making dietary changes, checking and controlling blood pressure, getting regular checkups to check the heart and the carotid arteries, following your healthcare provider's instructions and taking prescribed medications. Number 4 cause of death: lung diseases. Smoking damages the inner lining of the lungs. It makes it harder for the lung to expel harmful particles. It also prevents oxygen from mixing with the bloodstream. These changes put together can lead to a condition known as COPD, or chronic obstructive pulmonary disease. A number of lung diseases are classified as COPD, one of which is emphysema. Patients suffering from emphysema become short of breath easily. They may not be able to perform very easy tasks without feeling totally exhausted. Simple tasks, such as going up and down stairs or walking through a supermarket, become almost impossible. Some patients end up needing supplemental oxygen to be able to continue living. Pulmonary function tests help detect COPD at an early stage. The best way to prevent this disabling disease is to quit smoking. Number 3 cause of death: accidents. Many accidents can be prevented. Using seat belts and airbags, for example, are one way to prevent fatal car accidents. The best measure to avoid deaths and injuries from car accidents is to have the driver and passengers wear seat belts. Infant and toddler car seats should not be put in the front seats of cars with passenger side airbags. Alcohol is the cause of many fatal and disabling accidental injuries, including car accidents. Alcohol impairs judgment and reduces coordination. Driving under the influence of alcohol increases the likelihood of getting into a car accident. Number 2 cause of death: cancer. The causes of cancer are not known, but it is known that certain factors are associated with cancer. For instance, most people who have lung cancer smoke tobacco. Many people who have colon cancer do not eat enough food that has fiber, such as fruit, vegetables, and grains. Some cancers occur more frequently in families. This is true of colon and breast cancers. The body is formed of millions of small cells. Normally, the cells grow, multiply, and then die. Cancer starts when cells lose the ability to control their growth. Cancerous cells multiply out of control and often lead to death if not treated. Cancerous cells are called malignant because they can travel in the body and invade other organs. For example, cancer that starts in the lungs can spread to the brain and liver. There are several treatments for cancer. Treatment options may include surgery, medication, chemotherapy, radiation therapy, immunotherapy, or targeted therapy. The earlier the cancer is discovered, the more successful the treatment. That is why the key to cancer treatment is early detection. Some screening tests for cancer can be done without the assistance of a healthcare provider or nurse. Other screening tests for cancer are done by healthcare professionals. Women can have a mammogram to check for breast cancer or a pap smear test to check for cervical cancer. Your healthcare provider can help determine which cancer screening tests are appropriate for you. Test frequency depends on gender and age, as well as other factors. Make sure you learn how to do the self-screening tests. They do not take long to perform and can be done at your convenience. Performing self-screening tests can help you detect problems early and possibly save your life. A change of lifestyle can help a lot in preventing cancers. If you are a smoker, it is extremely important to quit smoking to decrease the chance of developing lung cancer. A well-balanced diet can help decrease the chance of colon cancer. Number 1 cause of death: heart disease. The causes of heart disease are similar to those leading to strokes, narrowing blood vessels and blood clots in the blood vessels of the heart. A decrease in the blood flow of the brain causes a brain attack or stroke. A heart attack occurs when blood flow decreases to the heart. The part of the heart that stops receiving blood dies. A heart attack occurs if the area is small. If the area is big, death may occur. After a heart attack, the heart may be able to repair itself by growing new muscles and new blood vessels. Several treatment options are available to help the heart regain its strength. All treatment options depend on the patient and his or her diet. The patient can control what type of food they eat and the amount of exercise they perform. You can help prevent heart disease by doing the following: stopping smoking, making dietary changes, checking and controlling your blood pressure, getting yearly heart or cardiac checkups, following your healthcare provider's advice and taking prescribed medications, enjoying a healthier life. There is a lot you can do to avoid the top 10 causes of death. Taking preventative measures now can help you enjoy a healthy life in the future. Deaths caused by smoking are completely preventable. The most important action you can take to be a healthy person is to avoid smoking. Secondhand smoke can also damage your health. Eating and exercise habits are established throughout a person's life. Changing these habits may not be easy, but change does not have to be painful. We will help you find a way to make these lifestyle changes fun and enjoyable. Do things you enjoy for exercise. Start with small activities such as walking and stretching. Set small goals, and as you reach them, reward yourself. Then set higher goals. Any kind of movement counts when it comes to staying active. Going up and down stairs, walking, and cleaning the house are all forms of exercise. The important thing is to stay active throughout your life. If you have had a heart attack or heart problems, make sure to perform any exercise program under the supervision of your healthcare provider. Exercise can help strengthen your muscles. This helps reduce the risk of accidents. It can help you prevent falls that could break a hip or accidents that could herniate a disc in your back. Exercise burns extra calories. This helps keep the body fit. It also helps reduce the likelihood of developing diabetes and narrowed arteries. Exercise strengthens the heart and reduces blood clots inside the body. This reduces the likelihood of strokes and heart attacks. Exercise makes us feel good about ourselves. Like exercising, healthy eating can also be fun. Try eating the healthy foods you like more frequently, but in smaller quantities. Eating 5 small meals or snacks instead of 3 large meals. Munching on fruit you like instead of chips. Using pepper and seasonings instead of salt. Healthy eating provides the vitamins and nutrients your body needs to fight diseases. Fruits and vegetables are rich in vitamins and minerals. Healthy eating provides the amount of energy your body needs. This means the body won't have to store excess food as fat. Alcohol, for example, is high in calories. Healthy eating provides the fiber your body needs to keep a healthy digestive system. This may reduce the likelihood of cancer. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Most diseases that cause disability and death among Americans can be prevented or delayed. Practicing healthy living habits and having regular medical screenings can help you avoid these illnesses. This can help you live a long and healthy life. There is a lot you can do to avoid the top 10 causes of death. Taking preventative measures now can help you enjoy a healthy life in the future. The top 10 leading causes of death are suicide, kidney disease, influenza and pneumonia, diabetes, Alzheimer's disease, stroke, lung diseases, accidents, cancer, heart diseases. Steps you can take to protect yourself include maintaining a healthy weight, eating a healthy diet, being physically active, controlling your blood pressure and cholesterol, protecting yourself from too much sun. Deaths caused by smoking are completely preventable. The most important action you can take to be a healthy person is to avoid smoking. Secondhand smoke can also damage your health. Thank you for using Explain.